Hello, I am Dr. Ajoy Tiwari. I am the Director of Jai Clinic and Diabetes Care Center, Lucknow, and I am also the Secretary of RSSDI UP chapter. So basically, yesterday I chaired a session that was about the controversies as regards to the management of hypertension. So it was a very interesting session because we had different guidelines, the American guidelines, the European guidelines, and then our very own Indian guidelines and the WHO guidelines. So the point is, why to measure blood pressure, what are the optimum levels where we should start management, and when we will label a patient as having hypertension. So there are a lot of controversies as regards to this, and this particular talk by Dr. Narsingh was all about this. So the primary thing was that most of the guidelines do agree that 130/80 is the optimum blood pressure, and as you go up from 130 to 80, you start having increased morbidity and mortality. So most of the guidelines say to start with you have to go for lifestyle management. 140/90 is a point where you have to strive to start the pharmacological management. The ADA, the American Diabetes Association, because basically I deal with patients with diabetes, they are still adamant on keeping the normal blood pressure as 140/90 for diabetic patients, because they say that the SPRINT trial, which was the main trial, which was basically adopted by ACC and AHA, it does not include people with diabetes. So they still say that the baseline for them is advanced trial, which talked about people with diabetes. So they say 140/90 for most of the patients, but for people with comorbidities like renal involvement, you have to keep your blood pressure 130/80. But over a period of time, lot of studies have come which has shown that keeping BP less than 130/80 prevents lot of morbidity and mortality. Thank you very much.